Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Alejandra, Content Marketing Specialist at 3W Medical for Women and the host of today's podcast. Hello, everyone. Welcome back to another episode with Wellness Wednesday here with 3W. I'm here again with Dr. Susan Rutherford. Hello, Dr. Susan.
Hello, Alejandra.
Hello. Yes. For those who don't know me, my name is Alejandra. I am the stand-in host for Helen while she continues to be on her maternity leave with her little baby boy, Max. So we're super happy she's enjoying this stage, and I'm super happy to get to step in for her. So
yeah, and I just love how you say your name. I cannot reproduce it.
Oh. And it's funny because I find myself saying it and not even really thinking like, oh, it sounds a little different, you know?
Oh, so, it's very pretty.
Oh, well, thank you. Thank you. Well, today, Dr. Susan and I are here because we're going to be talking about National Women's Health Week, which happens to fall May 9th through the 15th. And we're in a new month, everybody. Believe it or not.
Oh, boy. And isn't May 9th Mother's Day?
You are certainly right.
What an appropriate choice for the week.
Yes, very, very true. So, yes, we just thought we would share some fun points and insights on this week, why it's observed, and it being a women's health clinic here in Seattle. We thought, hey, we got to talk about this.
Absolutely. you know? Well, this is a reminder each year to women to take care of themselves and to make their health a priority.
Mm-hmm. Very, very true. So as we talk about some of these things, what would you say are maybe the key points of national?
Well, the short list is do your preventive screenings, including a well woman visit, get active, eat healthy, pay attention to your mental health, including getting enough sleep and managing stress, learn about depression in women, and avoid unhealthy behaviors such as smoking, texting while driving, and do healthy behaviors like wearing your seatbelt and using a bicycle helmet.
Simple things, right?
Yeah. I also recommend if you bicycle at night that you use lots of lights.
Oh, hey, and you're an expert at it. For those who don't know, Dr. Rutherford is an amazing bicyclist. She often bicycles here.
Well, I love it. I'm not such a great cyclist, but I do enjoy it.
She enjoys it. Yes. And if you guys haven't checked out on Facebook, I think it was last November, we posted a little post about her and her often biking into the clinic. So keep an eye on that. We might just do another post, but she's super active. But yes.
Oh boy.
Yes.
Well, in fact, talking about getting active, they've even, if you go to the CDC website, you've by now figured out that the cdc.gov is one of my favorite websites.
Yes.
But anyway, they even talk about what kinds of activity to do. They talk about how people that might have less access to places. I mean, I'm very fortunate. We have that wonderful bike trail over the 520 bridge.
Oh, yes.
You know, and most of the drivers that on the streets are decent, you know. And so I'm really pretty lucky living in this area. But there are some people that live where this isn't very easy. And people in wheelchairs or people, you know, with various difficulties need accessible exercise. And so they even talk about that on the CDC website. Really, so that everybody somehow should
get some physical exercise.
Get some exercise. Yeah.
Yes.
And it doesn't have to be exercise. The main reason to exercise when you're pregnant, in fact, is to have fun.
Is that right?
Yeah, you don't need to do aerobic exercise when you're pregnant, by the way.
Wow.
Because you're aerobically so fit just by virtue of being pregnant. But you do need to do it for your own mental health.
Right.
And that's the best reason. So let's see. What do you want to know more about? All these different items?
Yes,
Okay.
yes, please share with us.
So let's talk about eat healthy. I just learned that the COVID vaccine, not the COVID vaccine, the COVID virus and other viruses, and it was like a big aha moment when I read about this, that they like to eat sugar.
Oh, no.
Yeah. So I thought, So if you do actually more towards a ketogenic diet, it doesn't have to be severe restriction of carbohydrates, but, have some periods when you're not eating. This intermittent fasting, so-called, is a possibility.
Heard of that.
Yeah.
Yes.
And of course, just watching your carbs, that actually viruses, because they're desperately looking for sugar, they won't find as much.
Oh man! So maybe
like
that's more motivation, everybody.
Yes, and the comorbidities for the COVID virus, the coronavirus, the diabetes, being overweight, hypertension, et cetera, all those things that go with eating too much sugar.
Wow.
Yeah. So
that's a nice little goal that we can have, right?
Yeah. I'm trying to focus on vegetables myself, but I'm not vegetarian. I throw in some protein, chicken or shrimp or something, but. Yeah. Anyway, another really important thing, especially during this last year, it's the mental health issue has just gotten to be such a prominent, challenging
That's very true.
situation.
It's been very present.
Yeah. And partly because of our social isolation, In fact, I just finished a suicide prevention module for continuing medical education that was actually required to get my license again this year.
Wow.
And it was done by the University of Washington. And one of the things they emphasize is that people that begin to have suicidal thoughts, part of their plan for how to deal with that they work out, say, with their healthcare provider, would be to come up with ways to connect with people. People you phone, go to the neighborhood coffee shop, get out. And so having just done that whole educational program, I realized, man, that just really emphasizes how hard this lockdown, social isolation problem has been and why people are struggling so much.
True. And it says something too for like the abilities that we have technology wise.
Yes.
With calling a family friend
and the Zooming,
FaceTime, all those things that just to build those connections, because you're saying, it's a void that we have just because of the virus and how it's affected families and individuals in their day-to-day lives.
Yes. Really,
so
really
that's very good too.
Challenging. Yeah. Getting enough sleep, that's always a challenge.
Oh my gosh.
It's so easy to
I've wondered
burn
about
that midnight oil.
And for young adults too, and maybe even teenagers, when you think, oh, I have so much energy and adrenaline, I don't need to get that much sleep, but that's not correct, right?
That's correct.
You need at least 8 hours.
There are some people that function well on much less sleep, like 5 hours or something, but I never could.
No, me neither.
Oh man.
I know it affects me when I don't get enough sleep.
Yeah.
Okay.
So,
that's a good one.
Of course, smoking, fortunately, more people have gotten that message and fewer are smoking, but sometimes they're turning to alternatives to smoking that really aren't healthy. Marijuana is the one that comes to mind for me.
All right.
Especially when you're pregnant, don't do it.
Right.
You don't want to hurt your baby's brain. But it hurts your brain too. And anyway. So the texting while driving.
I didn't think about that one.
Yeah. Well, tell us I'm sure we've all broken that rule sometimes. Yeah. Mm-hmm. Yeah. Some cars now, the new cars with all the technology, some of them talk to you.
True. Yes.
So you can do it with your hands on the wheel.
Right. Yeah.
So that's pretty cool. I mentioned the bicycle helmet and the lights, the seatbelt.
Seatbelt.
Again, new cars, they won't let you. Even the older cars that had warnings beeping at you, they only beeped for a little while and then they quit. But the newer cars, they won't stop beeping.
They want your safety.
Yes. So those are good things. So let's talk about managing stress. Well, that's really hard to address. everybody's in such a different situation.
It's true.
Yeah.
It's so true.
They say manage stress, but I really,
it is a big umbrella, I
Yeah.
think, of trying to nail down. But I guess maybe thinking like for all of those that are listening, what is your environment?
Stressors? Yeah.
What are your stressors?
Well,
how do you respond?
What I just learned, for instance, from the suicide course is, so when you have the thoughts of suicide, what's triggered it? Where are you? What are you doing when that thought comes to you? So the same thing when you feel like you're getting really stressed, think about, well, what am I doing? What was I just doing? And of course, some of us can identify certain conversations with certain people, things like that. But that's probably something to pay attention to. Okay, if that really causes stress for me, how am I going to either avoid that situation, or how am I going to deflect it and turn something into more productive, less stressful activity or action?
It kind
just
of
hanging up on somebody, slamming the phone down. I'm not sure that reduces stress. I think saying, it's been nice to talk to you, but I really have to go now. And then gently hanging it up. That might work. But somehow if you do something in anger, you suffer as much stress or more stress than the person you're angry at.
Sure. It reminds me of a previous podcast we had on personal self-care. Right? Which kind of falls into that too. It's like, so if you have stressors, like recognizing those stressors and then seeing what are the things that you can do to take care of yourself, you know, because often we're on the go all the time. Of course, I think COVID has kind of helped us slow down a little bit because we can't do as much, but thinking too, like, what are things that I could do to help me have that self-care, which falls into, your health and your wellness, you know, all those things contribute. If we kind of put aside our self-care of like, you know what, I'm going to paint my nails today, or I'm going to take a bubble bath, or I'm going to go for a nice stroll in the park, something like that really does contribute, I'm sure. Right,
outdoors is huge. I think for everybody, nature is huge. I don't think there's anybody that reacts negatively to nature.
And the fact that we live here in Seattle.
Oh, we're so fortunate.
There's so many beautiful sites that you can go hiking or even the beaches, just to go enjoy.
Yeah, I mean, we're very fortunate.
Beautiful weather lately too.
Yeah,
which is a big plus.
Well, let's talk, since we're a medical clinic, let's talk about the medical piece now, which is the preventive screenings and that sort of thing. And it's called Well Woman Care. And there's a United States Preventive Services Initiative or Preventive Services Task Force. And they've come up with a chart specifically about well woman care.
Oh, gotcha.
And I think we're going to link it to the podcast, right?
We will.
Okay, so we'll get that chart, but it's on the Women's Preventive Services Initiative. If you're going to just not wait for that and go Google yourself, look for it. But they have this huge chart. It's broken down by ages, 13 to 17, 18 to 21, 22 to 39, 40 to 49. Actually, I think they should have interrupted by 30 because at 30 we changed the pap smear lab orders. But anyway.
Right.
But still, this is what they did. And the general health, I mean, that's the biggest category they list. They talk about alcohol screening, aspirin maybe to prevent cardiovascular disease. Although I don't know if that's still, I'm going to have to talk to a primary care doctor about what the latest is on that. But blood pressure screening, depression screening, diabetes screening, folic acid supplementation if you're thinking of getting pregnant, healthful diet, lipid screening, obesity screening, osteoporosis screening, prevention of falls. Of course, that's mainly for the older age group. Substance use, that sort of thing. Urinary incontinence screening. All of those are included. And then infectious diseases. Of course, we do a lot of testing for sexually transmitted infections here.
Right.
And they've got that whole list down there. They list immunizations. I realize people have different opinions. Again, I might go in and say, I don't need this piece or that piece. So, people, but this is something women should be in charge of. The patient should be in charge of these things.
Right.
And then cancer screenings.
Of course.
Breast cancer, that can be mammograms. Cervical cancer screening, that's what we've always called the pap smear. But now you also test for the virus that causes cervical cancer, the human papillomavirus. and lung cancer screening. You need to be on certain medications. Skin cancer. Of course, we don't have too much of that,
right?
Because we don't have enough sun. A lot of dermatologists say we should wear sunscreen every day. I don't know. We need some vitamin D too.
Yes.
But you could take vitamin D.
Right. Yeah. Well, for those that are...
what I do.
Yep. Those that are concerned about getting burned, put your sunscreen on. But yes.
Yes. And then take your vitamin D.
And take your vitamin D. Exactly.
Yes. We live in cloudy Seattle. So anyway, so that's this huge chart. And of course, what you can get here is we can order the testing. Some of the testing we'll draw here, the blood draws we'll do here and send out for some of the tests, at least for the sexually transmitted infection. Some of the lipid screening and everything, we'd send you to a lab for that. And we can do the cervical cancer screening, the Pap smears here as part of the well woman exam. The breast screening, we'll do the physical exams as you need it. Even that's being questioned actually by the American College of Obstetricians and Gynecologists.
Is that right?
It just doesn't make sense to me. But anyway, I think we did another podcast on breast cancer.
Yes.
But we can do all of that here. The other thing that's of interest is that there's a real effort to make sure that people that have maybe had historically less access to these, or maybe not access, but have taken advantage of some of these services less, are that there's outreach to them. Immigrants, certain minorities, the sexual minorities included, lower income maybe. One thing that's good about us is that you don't have to have any insurance.
Right.
We do like to know if you're insured because we like to know who we're serving.
Right.
But you don't need insurance to come here.
Just an ID?
We do ask you to cover the labs that we generate and send, because we have to pay an outside lab to do those. But they're pretty inexpensive. A Pap smear is $18.50, So,
you can't beat that.
Yeah, so we do have really reasonable costs for that. But in terms of addressing fears, we've had quite a few young women come in who've never had a pelvic exam because we want to address the gaps. One of the gaps is that there's very little time in so many medical appointments these days.
Right.
And so if you come in here and you're going to have a pelvic exam, you want to have a pelvic exam, we'll show you the instruments that are used, the speculum, for example, explain everything. You can use a mirror to watch. In fact, I just bought a device that we can actually look at the cervix and show it to the patient.
Wow.
Yeah. So I've only used it once so far, but I'm looking forward to doing more of that so that patients can actually see their cervix, see what it looks like.
That's something
it's basically a little,
get to see every day.
Need I say it's the same thing they use to inspect drains and air ducts?
Well, and I think
but it works great.
You explain it so well, and you help make the patients comfortable.
Yeah.
The more that they know what's going on, the easier it is.
Yeah, and nothing is done that isn't with the patient's assent and cooperation and buy-in for that. It's something I've number of times I've interrupted the exam and said, I don't feel like I can really proceed and do this comfortably for you. So let's talk about how to make it comfortable and at a future date, things like that. But the other thing is there's some people that, they're very worried about the pain and everything.
Right.
If you're really worried about well woman exam, you don't even have to have an exam. Just come in and talk to us.
Right.
Because sometimes just getting educated about your health can do as much as an exam. I can explain about how you feel your breasts, for example.
Right.
I can explain about what symptoms you might get that you should definitely go get a medical appointment for.
Right.
And we can talk about that, explain the whole exam, and that way, you can get some idea and ponder it, maybe look some resources up, or we'll give you some resources, and then you can, if you decide we want an exam, you're welcome to come here, or, go to your regular doctor where you would go otherwise.
Yes. No, I think it's great, Dr. Rutherford, how you encourage that as well, because I think it's so necessary. You don't get those consults.
Yeah. Well, and if we run out of time to talk about things and you decide you do want the exam, we'll just say, well, let's just set up another time to do the exam, because we want to make sure that there's enough time that you're not rushed
right
when that happens. And
it's key
because we don't bill insurance, you can come back, the next week.
Mm-hmm.
When there's no difference in how much it'll cost you. There's no limit. That's right. Well, we do want a lot of women to get.
True.
We don't want just two people taking up all the slots, but
right. But to say it's accessible.
It's very accessible. Yeah.
Right. So that's so great. Well, do you have can women actually participate in this day?
This event,
or in this week?
This event,
yes,
this holiday.
Now that you've given us all this awesome information on,
so
good points.
There's something called nationally called the Office on Women's Health.
Okay.
They suggest that you get active in their social media campaign. So you can use their social media and their promotional tools. And there's a link to that on, I got this from the CDC website and looked up Women's Health Week, and then it linked me to something else. And so, or you can look up Office on Women's Health. We'll try and put this link on the podcast thing. But anyway, you go there and you can share what steps you're taking and read what other people are saying.
That's great.
They have hashtags for social media messages. They say, hey, organize an event in your community. So you could get, all your friends in the neighborhood, hey, let's go for a walk outside, because it's still COVID, when it's not raining. How about Thursday, at 10 o'clock? How about if we go for a walk,
Well, that's good you mentioned that. Just having that buddy system, with other people that you could do if it is going for a walk.
Yeah. And then tell other people what you're doing, because when you read other people's stories, a lot of times you feel like, well, you know what? I guess I'm not alone.
Right.
I'm not the only one feeling this way.
Yes.
And, that's a good idea.
Mm-hmm.
So,
and knowing 3W is also here for, all our women in the Seattle area to come and get their women exams,
we get you started.
Exactly.
We get you started.
The education is here.
There are a lot of excellent family docs and OBGYNs in this region too.
Yes.
So if you want hints on how to find them, then we're welcome to share that with you as well. Because our goal is to get people to be really good consumers of their healthcare.
Exactly. And their own advocates.
And their own advocates.
Because
absolutely.
The more you educate yourself on your women's wellness, everything, the more you're prepared to take care of yourself. So I love this. Happy National Women's Week to all the women out there that are listening, that are going to listen to this podcast. And thank you so much, Dr. Rutherford, for
thank you.
These fun points and exciting tips for our women listening.
Thank you.
All right, everybody, thank you so much, and stay tuned for our next episode. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you liked this episode, please share it with others and consider subscribing on your favorite podcast platform so you'll never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.